Is it safe to have MicroPen procedure every 3 weeks? My aesthetician recommended that I have MicroPen treatments 3 weeks apart. Is that safe?
Thank you for your question. You state in your question, which you didn't submit with a photo, but you state in your question that your esthetician recommended that you get MicroPen or microneedling treatments every 3 weeks. And you're asking, is this safe? Well, certainly I can give you my perspective based on my experience. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Microneedling is a part of my practice along with other cosmetic dermatologic solutions like lasers, etc. And in fact, we actually combine microneedling very frequently with the use of topical platelet-rich plasma, and I'll explain to you why in a moment. So the question is why is 3 weeks, and what is the significance of that? From my perspective, microneedling is basically controlled injury to the skin. So to understand the physiology, you injure the skin purposefully to address certain issues, and most of the time you're dealing with a healing process in order to improve the skin. And that's not only true with microneedling, it's true with various lasers, whether it's ablative, fractional, non-ablative. This is really kind of the foundation of a lot of dermatologic procedures. So when you look at wound healing goes through a stage that's very important called the proliferative stage. This occurs over about 4 weeks. So the question we have to ask is, where is the advantage of rewounding the skin at 3 weeks? Is it to time it to try to maximize the collagen? If such is the case, I would probably be more conservative and recommend waiting 4 to 6 weeks. When we do microneedling, we actually, with that understanding in mind about the proliferative stage of wound healing, we actually use platelet-rich plasma as a topical to get into the openings which are created by the microneedling process. And why is that? Well, platelet-rich plasma is a concentration of the wound healing growth factors that are needed when you get a cut. And what it does is it stimulates new collagen, it stimulates blood supply. It has multiple beneficial factors that enhance the healing process. You see, again, the concept of controlled injury resulting in your body's response, well, with platelet-rich plasma, we augment the body's response. And the reason I'm stating that is that I'm trying to maximize the collagen response. Now, I would feel that if I'm taking someone's skin and then retreating them at 3 weeks, I'm inducing a new injury probably earlier than the full healing of the previous treatment. So, with that understanding in mind, I would probably say, even if you're doing a lighter treatment, you're going only down about 0.5 millimeter, you have to really understand what's the purpose. The deeper you go, and the range can be anywhere from 0.5 millimeter to 2.5 millimeters, the deeper you go, the more of an injury you create, the longer it takes to heal. So you have to have this discussion and understand what's the purpose of this treatment. If your esthetician is recommending every 3 weeks, then chances are it's more of a superficial treatment. But if it's a more superficial treatment, then what's your end point? What are you looking to finally accomplish? Where does this journey find a plateau with this type of treatment, and when does the maintenance phase begin? Because that's kind of like the idea of therapeutic intervention in skin, is you sometimes have to do something aggressively, either at a single time or over several visits, and then you have to do something for maintenance. So these are questions that you should bring up to your esthetician so you can get a clearer understanding. It's not my intention to undermine what the recommendation is, but it's my goal that you understand what the logic is. I feel that every patient should be very educated about the plan so that they can participate intelligently in optimizing their results. So I hope that was helpful. I wish you the best of luck, and thank you for your question.